Today we're going to talk about infection and inflammation and how the body responds when something harmful enters the system. Because a lot of symptoms people experience aren't random, they're part of a response. At a basic level, infection is a trigger, and inflammation is the body's response. The body is trying to recognize a threat, contain it, and eliminate it. When something like bacteria or a virus enters the body, the immune system activates, and that activation leads to inflammation. Here's a simple analogy. You can think of it like an alarm system. When a threat is detected, the alarm goes off and the body sends resources to that area. Inflammation increases blood flow to the affected area and brings immune cells to fight off the infection. Here's the key signs of inflammation. These are the classic symptoms: redness, swelling, warmth, and pain. Here's why those happen: redness and warmth from increased blood flow, swelling from excess fluid and immune cells entering the tissue, and then pain from pressure and inflammatory signals. One of the most common systemic responses is fever. Normally, your body temperature is around 98.6 degrees Fahrenheit. A fever is generally above 100.4 degrees Fahrenheit. Fever happens because the body raises its temperature to slow down bacterial growth and improve immune function. Now we're going to talk about white blood cells. They help fight infection. Normal white blood cell count is about 4,000 to 11,000. Elevated white blood cell count often indicates infection or inflammation. Now we're going to talk about why they increase. The body produces more immune cells to respond to the threat and fight it off. So to bring it all together, the pattern becomes clear. Infection triggers a response, inflammation brings blood flow and immune cells, and ultimately symptoms reflect that process. So our next point here: if the infection stays localized, the body can usually control it, but if it spreads, it can lead to a systemic response called sepsis. Sepsis is when the body's response to infection becomes widespread, and instead of helping, it starts to disrupt normal function. That widespread inflammation can dilate blood vessels, cause fluid to leak, reduce perfusion, which can lead to septic shock. Here's some quick patterns. These are high yield. Infection is the trigger, inflammation is the response. The fever is a systemic response. Elevated white blood cells is indicating immune activation. Sepsis is widespread dysfunction. Here's another analogy to really think about this. You can think of it like a small fire in a house. At first, it's controlled and useful. It helps keep things running. But if it spreads too far, it can burn the whole house down. That's what happens in sepsis. Your body's response starts to spread, and instead of protecting the body, it begins to cause damage. When you step back, this system is about response. How something small can begin to affect the whole body. You can even see this in everyday life. When you're sick or injured, it doesn't just stay in one place. It starts to affect how your whole body feels. And in more severe cases, like sepsis, that process can become life-threatening. In a similar way, Scripture uses this idea to describe something deeper. Do you not know that a little leaven leavens the whole lump? In that context, it's referring to how even a small amount of sin can spread and affect the whole. If you're interested in that side of things, I've made some videos on it as well.